Hello, my name is Tammy Toon. Thank you for joining me today as I present my Senior Capstone Project. This is my government official ID. Today I'm presenting my Senior Capstone Project titled Improving Outcomes for PAD Patients Through Structured Exercise Prescription Program. This practicum took place at Hermes Healthcare, Inc. under the guidance of my mentors Kim Flory and Janie Hermes. My capstone project was completed in an outpatient clinic. The project was developed in alignment with course requirement, emphasizing leadership, education, and research. I used Dorothea Orm's self-care deficit nursing theory to guide the work, focusing on helping patients care for themselves through structured and support. I chose to work with Kim and Janie as my mentors due to their combined knowledge and expertise of the clinic and what the clinic is accomplishing to help existing PAD patients. The main goal was to create and implement a structured clinical protocol to help patients with Peripheral Artery Disease, or PAD, improve their symptoms and outcomes through exercise. The project aligned with my nursing coursework and expanded my skills in both evidence-based care and patient education. In the in-service, I made a PowerPoint on PAD and created this for Hermes Healthcare. I presented it to the nursing team in the company's Microsoft Teams platform. And it can be used over and over again for refreshing and educating existing staff and new hires. The project benefits include improved patient outcomes, a standardized approach to managing PAD, and staff education to help boost confidence. It also promotes patient independence, which fits perfectly with Orm's theory, once again, and the RN to BSN program's emphasis on holistic and collaborative care. The sample added here is a partial sample of the clinical template used to assess PAD patients in our clinic that I created. My mentors, both experienced advanced practitioner nurses, offered strong guidance. My key goals were to develop clinical guidelines, collaborate with the healthcare team, and educate patients. Each of these goals supported professional development and improved patient care. Hermes Healthcare is a professional, high-functioning outpatient setting. Patients with PAD are commonly seen, which makes this ideal environment for this project. The staff was open to collaborating, and equipment is available for screening for the ABIs, and we can send people out for EKGs as well. Scheduling and clearance procedures sometimes delayed patient onboarding. There were also challenges in patient understanding of PAD. To adapt, I adjusted follow-up timing and I created educational materials that simplified key concepts while supporting patient self-care. I made a flyer that I added to the workbook. I collaborated regularly with my mentors and the broader care team, and we held planning meetings, reviewed tools, and made joint decisions about implementation. This project strengthened my ability to work across disciplines towards a shared clinical goal. I created a full set of tools, a step-by-step exercise protocol, staff education resources, and patient materials and logs. These tools were designed to be simple, sustainable, and consistent with evidence-based practice. They also help patients and providers stay on track. The clip above is a sample of the education flyer I created for new and existing PAD clients and patients. I evaluated success through increases in PAD exercise referrals and improvements in patient-reported symptoms and their ABI scores. Staff completed pre- and post-intervention surveys to assess learning, and patient adherence was also tracked by using logs and follow-ups. This experience helped me grow as a leader. I took ownership of protocol development and answered provider questions confidently. I became more comfortable facilitating change and addressing challenges in real time. The biggest takeaway is that this project can continue beyond my practicum. Providers now have a consistent tool to manage PAD, and patients are more aware of how structured exercise can improve their lives. It is a scalable and sustainable intervention. In summary, I accomplished all of my stated goals, enhanced my leadership and education skills, and contributed to a real clinical improvement. This project will influence my future nursing practice and has prepared me for expanded roles in healthcare. Throughout this presentation, I've aimed to maintain professionalism in both content and appearance. I've practiced extensively to keep my timing under 15 minutes and to ensure clarity and organization throughout the slides. All required components, hours, evaluations, and feedback have been submitted. I am grateful to my mentors, instructors, and colleagues at Hermes Healthcare for their support. Thank you for your time today. Here are my 3 document links I created for the Capstone Project on Peripheral Artery Disease, PAD. I've included the links to these to be able to allow access for use for future patient education. Lastly, here are my resources that were used in my Capstone project. And thank you for listening.